Hello, everyone, and welcome to another episode of the podcast Your Personal Child Specialist with Dr. Gaurav Gupta. I trust that you and the children that you take care of are doing well. With this, let me come to today's topic, which is collecting urine for testing in children and babies. Now, urine examination is one of the mainstays of diagnosis of fever in children. The challenge is that for older kids, we haven't been taught the right technique by the pediatrician. And for the younger kids, even if we know the right technique, it becomes very difficult and cumbersome to collect the urine. So let me start by telling you why urine collection is so important. Many cases of fever in children can be because of urinary tract infection. And unlike many other infections, if you miss a urinary tract infection, this can cause permanent damage to the kidneys. This is why diagnosing a urinary tract infection is far more important than diagnosing other causes of fever in most children. Now, that being said, let's look at the techniques and the main pitfalls and problems that are to be avoided. Let's start with the older children first, wherein at least taking the sample per se is not difficult. The technical term for collecting urine in older children is midstream, clean catch, first morning. Okay, so let's analyze this. First morning means the first sample of urine that is passed by the child in the morning. Why is this important? Well, because the first morning sample is concentrated urine and you are likely to see infections and inflammation changes in this sample. Clean catch refers to urine sample that is taken after cleaning the private areas of the child. This is as simple as using soap and water and cleaning the area before you collect the urine sample. Along with this, especially for girls, it's quite important that you keep the legs apart and keep the lips of the vagina apart when you are collecting the urine. This is to prevent the urine from touching the sides of the skin or of the labia and thus preventing any kind of bacterial contamination and a wrong report. So many times we see wrong reports, we see reports of bacterial contamination of the urine, and these are the main reasons why it happens. Finally, we have to take the midstream sample. Now, what does this mean? Well, to be honest, while I was doing my MBBS in college, even I was confused about this. But it's actually not difficult. All we need is to take the sample from the middle part of the urinary stream. How do we do that? Well, when the child starts passing urine, we let the urine come out and after a couple of seconds, we put the urine bottle to collect the urine sample. And similarly, before the child stops passing urine, we take out the urine bottle. Why do we do this? Again, this is to prevent bacterial contamination with the bacteria that are stuck to the side of the skin. So if you do this, first morning, midstream, clean catch sample, most of the times you will get a very good report and there are less chances of any diagnostic problems. Now, we come to the big elephant in the room, which is, how do I do this for a small baby? Most kids above the age of 4 or 5 can cooperate with urine collection. On the other hand, practically none of the kids who's less than 2 years of age will be this cooperative. So what do I tell these parents? I say that the best time to collect the urine is when the child wakes up. This is especially true in the morning. When the child wakes up after an overnight sleep, there is a chance that this child will immediately pass urine. So remove the diaper if the child is wearing any and be ready to catch the stream. Now, you may not be able to do all the steps that I mentioned above, like cleaning the private area or collecting the midstream. But to be honest, something is better than nothing. And a urine examination is very, very useful for pediatricians because it can tell us immediately what is the problem with the child, why the child is running fever, and more importantly, if we do not diagnose urinary tract infection at the right time, we can end up with long-term kidney damage. I have a child in my follow-up right now who's more than 10 years old, and she has been diagnosed with kidney disease since the time she was 4 years, possibly because of missed urinary tract infection. And now they're planning to get a kidney transplant done because her kidneys are failing. So remember, parents, if your pediatrician cannot find the cause of fever, they may ask for a urinary examination, and in that case you can use some of the above mentioned steps to make sure that you can get a urine sample. So how do you help collect the sample of your kids? Do post in the comments, and remember to share this podcast with other viewers and other listeners too. Any other parent or caregiver of child may actually be very, very grateful if they come to hear these steps. Till the next time, take care. Bye-bye. Remember, you can always write to us at yourpersonalchildspecialist@gmail.com. Of course, if you are listening to this on YouTube, feel free to comment as well. I have received a couple of comments from some fellow pediatricians and a parent also. The first of this is, what about urine collection bags? Well, I remember the days when we used to recommend these for collecting urine for kids. But honestly, the results are disappointing, and in many cases bacterial contamination is seen when you use urine collection bags. So I do not recommend it because they are cumbersome and the results are not necessarily accurate. The other point, which is very well taken, is that for small babies, the best way to actually sample is by doing something called a suprapubic aspiration. What this means is that a needle is put on the lower part of the abdomen in the center, just above the pubic bone, pelvis bone, and just by tapping into the urinary bladder, you can take out urine, which is perfect because it is absolutely sterile, and any infection that you pick up from this sample is 100% due to a definitive urinary tract problem. The only issue is that in today's world, it is not very easy to consider doing this slightly invasive procedure in an OPD outpatient office setting, because we have to hold the child and we have to blindly do this procedure, and the chances of complication, though very rare, do exist. Hence, I recommend this procedure when a child is admitted to a hospital or in a hospital outpatient setting, preferably if you have an ultrasonologist who can do an ultrasound and make sure that the bladder is full, and then you take this urine sample. So thanks everyone for commenting, and do keep writing. Another very interesting tip has been shared, and I do remember talking about this myself as well, is that for a small baby, if you are only interested in during a urine routine examination and not a culture, you can take the sample of a polythene sheet. Just make the baby sit on a polythene sheet and let him play as normal, and when the child passes urine, just collect it in a sterile container. This urine cannot be used for culture but can be used for routine screening for a UTI or a urinary tract infection. Do remember that a stool sample should not be mixed with this urine, as that can lead to bacterial contamination.